The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. My name is Ryan Eborn, and I am here today on behalf of the marketing team with School Health. I want to start off by thanking you for joining us today and for participating in our webinar with Shawn Sima, who, along with his family, leads the nonprofit organization Lexi's Lifesavers, an organization that works to train as many future rescuers as possible and donates AEDs to families and organizations who need them most. Before I turn the time over to Shawn, I'd like to review a few quick things about today's webinar. Number one, we will not be taking audio questions during the webinar, but there is a questions interface in the GoToWebinar system that we're using today, and you can submit your questions for Shawn anytime during the presentation. Shawn will take around 45 minutes for his presentation. Afterwards, we will start answering your questions in the order in which they were received. We will be recording this webinar today, and a link to it will be posted on our schoolhealth.com site, and we will also email a link for the webinar to all of you for future playback. Everyone who attends today's webinar will also be receiving a certificate of attendance for joining today. I know that I've heard many questions from many of you of if the attendance today will count towards CUs or towards some credit, and that is up to your individual school system. Many school systems will accept this hour as credit, some do not, but we will provide you with a certificate of attendance for joining us today. You should expect that by email in the coming weeks. If you're having technical difficulties with the audio or visual portion of today's webinar, please contact GoToWebinar directly at 855-352-9003. Again, that number for GoToWebinar is 855-352-9003. And lastly, I wanted to make everyone aware of a special offer that we have from Cardiac Science, who is our partner in providing this webinar today. We will be having a drawing for everyone who signed up and is attending the webinar today. And the winner of that drawing will receive a free Cardiac Science Power Heart G5 AED trainer. Now, this is a device that you can use in your schools with your students or in community groups and help people be trained in the right way to use an AED. Kind of take the fear out of using the AED. It gives instructive voice commands, walks you through the proper use of an AED, and we will be giving one of these G5 AED trainers away to one lucky recipient. And that's it for me. I will now turn the time over to Shawn for his presentation. Shawn?
All right. Thank you so much. Good morning, good afternoon for some folks. I'm over here in Melbourne, Florida, and I really appreciate the opportunity to talk to everybody. This is something that, sudden cardiac arrest, it's something that's near and dear to my heart. And I really hope to open some eyes today. And I'm really looking for some partners, and we'll explain that a little bit further as we go on in the presentation. Our objective today is to teach you and tell you about sudden cardiac arrest. We want to talk about hands-only CPR, what it is, and how you can implement a program in your school. We want to talk about a cardiac response plan, and then just basically how you can lead the charge at your school, your town, and hopefully your state, and later on in the country to implement, CPR, cardiac emergency response plans throughout our communities. It's very important. I'm a 20-year military retired Air Force major. I was a physician's assistant. I've done orthopedics for almost 20 years. And, this is, again, something that's near and dear to my heart. Trying to advance to the next slide here. All right, here we go. So my story. So I'm a real American success story, to be honest with you. I grew up on the east side of Jacksonville, Florida. I was very poor. My parents didn't have much. I enlisted into the Air Force with not much more than a bag of clothes, honestly. The Air Force, during my 20-year career, sent me to school. I got my physician's assistant's degree. And then they sent me for a 1-year residency in orthopedics. And I did 20 years. We were the postcard family. You know, I have a wife and 2 kids, my daughter Lexi and my son Carter. My daughter Lexi has always been extremely active. She was a cheerleader, a softball player, basketball player. I mean, she did it all and never really had one health problem ever. The picture of health. So let's fast forward to February 2nd, 2016. Thank God for the iPhone, because these are actual screenshots. So I'm going to set the scenario. My son, who was a high school lacrosse player, we were having a lacrosse benefit for him at a place called Long Doggers. It's a local restaurant in our area. So, you know, this sort of sets the scene. We were trying to get everybody together so we could all meet up to, you know, at Long Doggers, have some food, and you know, do some bidding on some prizes. So at first she said she couldn't go because she had a softball game, but later on, as you see, about 6 o'clock, you know, she decides that she's going to figure out what's going on. So, you know, we sort of go through the motions with her, and then she decides she's going to come. She wants us to order her some tuna, as you see. And then she messages us and says, wait, I'm going to go to the gym. Can we order you the tuna? So the night goes on, you know, as planned. And then all of a sudden, I get this message, right? Nobody ever wants to get a message from somebody named Big Mike. You know, Big Mike, for you guys in the Northeast, he's sort of like Joey and Rocco, right? You don't want to hear from these guys because typically it's not good news. But you can see what he says, right? Is your daughter here working out? Is she the one with the knee brace? Yes. And then look at that. I mean, those of you who are parents, look at that last statement. No, it seems bad. Get here. So I freaked out. So as God would have it, Long Doggers was actually right around the corner from the gym. So I ran out of Long Doggers and I sprinted over to the gym. And this is what I saw. Now, this is an actual picture taken by Big Mike. And he told me that he took this picture just for lawsuit purposes, believe it or not, but that's aside. But this is not a staged picture. This is my daughter, Lexi, laying there dead. This looks like a textbook CPR, you know, photo. I've taken many. And this is typically what you see. He's checking for a pulse. The AED is in place. You know, and I could tell you in that picture there, that was before I got there, but she's dead. The shock hasn't been delivered yet. My daughter is dead. Her eyes are rolled up in her head. She's gray. She's pulseless. She's dead. I've deployed in the military. I've seen dead people, and my kid was dead. And that's just not anything that can even register in your brain. So as you see in this picture, if you look really closely, they're actually doing CPR. I don't know if you can see the hands on the chest. We'll go on to the next. So again, this is her. This is Lexi. This is my whole life, right? They were doing chest compressions on her. And by the time I got to the gym, they actually had delivered the shock with the AED, and they had a pulse back. It took about at least 12 minutes for the ambulance to arrive. And these folks in the gym had her a pulse, and she was, you know, breathing, but she was still unconscious. And this, to me, is her. This is her greatest title ever. And my daughter is a superstar. You know, we all brag on our kids. But she's been the captain of the softball team, the captain of the basketball team. She's been the homecoming queen for her 10th grade class in high school. She's done it all. She was a model child. They life flighted her that night, and they brought her to the emergency room over in Orlando. And that night, my wife flew on the helicopter. I drove about 45 minutes. And when we got to the ER, she was still unconscious. They had her tube. They had all the, the wires that connected. She was in a hypothermia sheet, and they were trying to bring her temperature down. But my daughter was seizing. My daughter was losing control of her bowels and her bladder. And we didn't know what was going on, number one. And number two, I didn't know if I was ever going to see my daughter alive again. I made so many deals with God that night to please let her live. The beautiful home, the beautiful cars that I had, the life that I had, none of it mattered. All that mattered was my kid, and was she going to live or die, and what the hell was going on, because this was nowhere near on my radar. My life was turned upside down. I heard a saying recently that said, if you lose a spouse or a parent, you lose your past. But if you lose a child, you lose your future, because nothing is ever good enough. And it's really ironic right now that recently or yesterday we had a $1.6 billion lottery. And around this same time in February of 2016, we had the first $1.5 billion lottery. And actually somebody from my hometown was one of the 3 winners. And there was no money. I don't care if it was 10 billion. When your kid is dead and you're not sure what's going on, there's no money. You want to talk to God, and you want to switch places with your kid. This picture here was on the front page of our paper. These are the 3 gentlemen that were there last night. There was another girl, but she couldn't make it. These guys are our heroes. These guys are the reason that we're almost back to happy again. I don't know how better to say it. The people that were working the gym that night, they had no clue what to do. Thank God they had an AED. And do you know that AED battery was dead? Did you know that AED, the pads were expired 3 weeks before this happened? By the grace of God, the owner happened to look and see that the green light wasn't blinking, and he decided to go ahead and replace the battery and the pads. That his staff, who was supposed to be doing the checks, they weren't doing them. And thank God that he came through for us, essentially. But I will tell you, these 4 people that you see, they're part of our family forever. They gave me my life back. They gave my wife, her life back. I got to see my daughter graduate high school in May because of these guys. One day I'm going to get to walk my daughter down the aisle and present her to her husband because of these guys. One day I hopefully will hold a grandchild because of these guys. And we could go on and on and on. She'll probably put me in a nursing home one day, and that'll be because of these guys. They're forever a part of our family, and we love them. But I want to tell you, while she was in the hospital, I started doing research, right? I'm a physician's assistant. I've graduated with honors. I've passed my initial boards in the highest percentile. I've recertified 3 times, and I've done excellent. Now, my focus is orthopedics, and we're sort of like the Carpenter Neanderthals in medicine. But I did a lot of research, and what I learned, it just blew me away. I'm embarrassed to say that this was nowhere in my mind. I couldn't wrap my arms around the stuff that I learned. And that's what I want to share with you. And I hope I blow your mind, and I hope you'll take this information and go to your bosses and your legislators, and you'll blow their mind too. So first and foremost, what is sudden cardiac arrest, right? I'll be honest with you. I had it all wrong in my head, and I have 20 years of medical experience. So what do we expect from a guy, who's an auto mechanic, right? So sudden cardiac arrest is nothing more than electrical disturbance of the heart. And we're going to go into this a little bit further, but this is Mayo Clinic's definition. Whereas a heart attack, now it drives me crazy when I hear, oh, that young boy died of a heart attack playing football. It's not a heart attack. A heart attack is a clogged artery problem. It's not an electrical problem. Sudden cardiac arrest is a medical emergency. Obviously, if it's not treated, it's going to lead to somebody dying. But I always had that confused. Cardiac arrest, yeah, we all die from cardiac arrest. Simple cardiac arrest is your heart stops beating for whatever reason. But sudden cardiac arrest is its own entity. And I never wrapped my brain around that. I never gave it much thought. So some of you, I hope, are over the age of 40 and you get this reference. I gave this briefing 3 or 4 weeks ago to a bunch of young people, and they looked at me with blank stares. But this obviously is Fred Sanford. So I don't know if you remember, but when Fred Sanford was stressed, he'd always grab his chest and say, you know, Elizabeth, I'm coming to join you, honey. So that's sort of the play on the heart attack, right? So here's a heart attack. It's a plumbing problem, right? When I met Lexi's cardiologist in the hospital, he explained this to me. He said there's plumbers. Those are the guys that deal with blocked arteries, right? There's electricians. Those are the guy that deals with the electrical system of the heart. And then there's carpenters, and those guys deal with the structural issues. So the classic heart attack is from a clogged artery, right? You typically have time. Those are the Fred Sanfords. Chest pain, shortness of breath, they get jaw pain, they got sweats. If you don't do anything about it, then yes, it can lead to cardiac arrest. Sudden cardiac arrest, the best way I ever had it explained to me was like your computer. You're sitting at night, you're typing up a project for school, you get a lightning strike, right? You don't have a good surge protector, and all of a sudden your computer starts blinking and going crazy. That's exactly what happens with sudden cardiac arrest. It's an electrical problem. It's a power surge to the heart that sends it into chaos, right? Your heart is not pumping, it's actually quivering, and there's a difference. It's usually sudden, it's usually without warning, and in 80% of the cases, sudden cardiac arrest and death is the first symptom. I threw this in, and we're going to talk about structural real quick, but this really helped me understand the difference, and I think we'll be able to wrap it in later. But just like with your computer, right? If your computer goes on to blink, you hit Control-Alt-Delete, and it restarts the computer. And that's what the AED essentially is. It's something that you use immediately to restart the heart, to stun the heart and get it back into a normal rhythm. The last thing is the Carpenter issue. That's a structural problem. Typically, this is something that you're born with. Just know that there's a bunch of causes that, of structural heart problems and heart damage that typically we're born with. I'm not going to go deep into it. And then on this slide, we're talking about causes of sudden cardiac arrest. Again, there's a bunch of them, but the big ones that I really want you to keep an eye on is like drugs, right? Heroin, opioids, the unexpected, drowning, electrocution, lightning strikes. We had one of those recently here. Chokings. All of those can lead to sudden cardiac arrest. So that's why the CPR component, the AED component is so important. All right, so this is where I'm hopefully going to be able to blow your mind, because I know when I went through all this information, it blew my mind. So who's number one, right? Of course, USA, we're always number one. But there's one thing for certain in medicine, and then the world, the United States. Sorry about that. Try to go back here. Sorry about that. So I don't know if you know this. I didn't know this. But did you know that sudden cardiac arrest is the #1 killer of Americans? And I used to think, of course, cardiac arrest is the #1 killer of Americans, because when you're dead, you have cardiac arrest. Your heart's no longer beating. But I was wrong. And most people don't get this. When I talk to people about this, they look at me with a blank stare, and then their eyes all of a sudden blow open. Sudden cardiac arrest is the largest cause of death in the United States and the world for that matter, okay? there's probably 7 million is the guesstimate people die worldwide every single year. At least 325,000 Americans die every single year from sudden cardiac arrest. And that information is skewed because now there are specialized autopsies that they do, and not everybody does them, to look at the tissue of the heart. These guys that are world-class swimmers and then all of a sudden they drown, it's a likelihood it was sudden cardiac arrest. The one car crashes that hit the tree and there's nothing wrong with the car, it was likely sudden cardiac arrest. Even these guys that overdo it with energy drinks and cocaine, those deaths, typically they have an underlying risk for sudden cardiac arrest through a genetic component, and that activity finishes them off. So how about this? Did you know that heart disease and sudden cardiac arrest is the #1 cause of death in the workplace? At least 10,000 Americans die at work every year. How about this? Our first responders. Did you know the #1 killer of firefighters is sudden cardiac arrest, not fires? How about our cops? Now, you know, this information, as you can see, I have it highlighted. It says if it's extrapolated over a 24-hour period, you know, it's the #1 killer of men and women in uniform. Just know that this is one of the leading causes. And that last highlight, cops are 25 more times likely to suffer death and disability from heart disease than from a violent act of a suspect. How about this? I just presented to the military a couple weeks ago. The #1 non-traumatic cause of death in the military is sudden cardiac arrest. I read a study from 1998 to 2008. Our U.S. military lost 1,000 troops to sudden cardiac arrest. Not the Iraq War. It was sudden cardiac arrest. The #1 killer of our college athletes, sudden cardiac arrest. And then this is really where I want you all to pay attention because this affects you all. The #1 killer of our high school student athletes is not concussions. It's not broken necks. It's not lacerated spleens and livers. It's sudden cardiac arrest. The #1 killer of our kids at school in general is sudden cardiac arrest. Again, it's not fires, it's not violence, accidents, it's head injuries, natural disasters. It's sudden cardiac arrest. And what's getting all of the press right now, which I have kids in school, so I'm a big supporter of whatever you can do to protect my kids. But it's not guns, right? You know that since 1999, which is when Columbine happened, there's been 85 school shootings. There's been 223 deaths, and a lot of those includes teachers as well. So in a 19-year period, we've lost 223 kids and teachers to gun violence. I'm going to steal my own thunder. Do you know how many kids die every single year? 6,000 kids die from sudden cardiac arrest. That's 20 kids a day die from sudden cardiac arrest, but we never hear about it. We see little blurbs in the newspaper, and then that's it. We don't hear another thing. So I'm going to just go through the facts. Again, this all stunned me. So again, 325 to 400,000 Americans are lost every single year. Only 10% survive, right? So if you have 100 people laying on the ground in front of you right now in today's environment, only 10% are going to get up. My Lexi is one of those 10. And at the time when this happened to her, it was only 7 out of 10. There's one death every 90 seconds in the United States. 1 out of 4 American deaths are due to heart disease. Half of those are due to sudden cardiac arrest. And just by simply doing CPR, we could save, you know, anywhere from about 100,000 lives a day. And that's just basic CPR. And we're going to go into that. African Americans 2 times as likely to experience cardiac arrest. And they're also 2 times as likely to die from sudden cardiac arrest. So look at these stats. I'm going to be quiet for a couple seconds, and I want you to take all of this in. Look at this pie chart. If this don't blow you away, and why, if you're like me, like, why aren't we seeing commercials on TV about this? Nobody truly understands. People hear cardiac arrest, and then they think, oh, of course, cardiac arrest. We all die from cardiac arrest. But if you put all of these together, all of the high profile stuff, right? Car crashes, house fires, opioid and drug overdoses is a big one, suicides, it barely equals the number of people that die every year from sudden cardiac arrest. Let's look at it per day, right? So almost 1,000 people die every single day from sudden cardiac arrest. 197 for drug overdoses. Do you think in our country that if we had, let's just say 3 planes, right? So if you load up 3 planes, that probably equals 1,000. If we had 3 planes every single day crashing in the United States, do you think somebody would do something about it? 3 planes a day, what would they do? You and I both know that answer. What about our kids, right? So I said it, and I even said it wrong. It's 7,000 kids die every single year in the United States, at least. And again, the data is skewed because, you know, of the other things that I talked about. 20 kids a day, every day from the in the United States. 1 student athlete dies every 3 days. Again, 80% of those, the first symptom is death, right? They don't get the chest pain, the shortness of breath. They're alive and they're dead. Studies show that 1 in 300 youth have an undetected heart condition that puts them at risk for sudden cardiac arrest. So I want you to think about the number of kids in your school. And then 1 in 500 have hypertrophic cardiomyopathy. Again, that's a hereditary heart condition. And it's also the #1 cause of sudden cardiac arrest in our youth. This is just a quick table I wanted to show. You know, many people think young people don't die from heart disease. If you look at this statistic, this was from 2016. So I think Parkland, you know, they lost 17 kids to the school shooting. And again, please, you know that I'm behind them 100%. But, you know, the numbers don't lie. The numbers dictate that we need to protect our kids from the #1 assassin in the world. And he doesn't carry a gun, and he doesn't carry a backpack. So let's go into a little bit of statistics with sudden cardiac arrest. So I like this chart here, and basically for every minute that a person is in sudden cardiac arrest, that nobody does anything, the chance of them surviving drops, 10% with each minute. Brain damage by 4 minutes, and it's rough to get them to come back by 5 to 7 minutes. They're likely, even if you get their heart restarted, likely they're going to have so much brain damage it's going to be, it's not going to be good. If you can get them defibrillated within the first 1 to 3 minutes, there's a 90% chance you'll save them. And then after 10 minutes, the chances are dismal. We all hear those stories, just like, grandma smoked to be 95. Smoked her whole life and she lived to be 95. Those stories do happen, but it's not the norm. So the American Heart Association study showed that 70% of all these events happen at home. They also show that it's an 8 to 12 minute average for the ambulance to get to your house. So let's think about those statistics we just looked at. So if you call on the phone and you stand there and wait, basically that loved one, that kid at your school is going to die. And I always like to think, what if you came home from work and you saw your kid at the bottom of the swimming pool? Would you dial 911 and stand there and wait for the ambulance to get there? No, right? We're going to jump in. We're going to run into a house fire. When it's our loved ones, we'll do whatever it takes. So your family's life is in your hands. And that's why it's so important that every kid in the United States learn hands-only CPR, because it's a 7 out of 10 chance that they're going to be the one to save their mom, dad, sister, brother, grandmother. you name it. So classic CPR, right? I love this slide. Classic CPR, or the CPR that those of us that carry some sort of a medical license, we have to do it, right? That includes the breaths, chest compressions. But the average person, and including even probably me, if I'm on the street and there's a stranger or somebody who I'm nervous about, I'm probably not going to put my mouth on them, right? So studies show right now that 30% of people in the United States know CPR. So that means 70% don't. And then there's only about a 15 to 30% chance that somebody's going to help you if you go down. I always like to say CPR stands for Can't Perform It Right Now, because most people don't know how to do it. And then the AED is an excellent device that nobody wants to use because they're afraid. So why don't 70% of people want to do CPR? Why don't they want to make a difference and save a life? Well, believe it or not, the number one reason, 68% of the time, and I get it, we're a health conscious community. People don't want to put their mouth on somebody else's, right? So instead of doing anything, they just stand there and wait. How about this in the litigious society that we live in, right? Every other commercial here where I live is some lawyer commercial on call me if you want to sue somebody. The studies show, and I've met with several lawyers, nobody has ever had a judgment against them for doing CPR and using an AED. Nobody. There hasn't been one case settled, and every state has a Good Samaritan law. You think about it, if one person was sued and that person lost, who would do CPR? Nobody would. And I know I think it's Vermont or New Hampshire, they actually have a law that if you don't do something to help, that you could actually be fined $100. And then what about the AED, right? Most people are super afraid of the AED. They watch, like Grey's Anatomy, the Dr. McDreamy's making out with his nurse, then all of a sudden he's got to run to the ER, grab those paddles, put them on. All right, everybody clear. And then he's got to push the button. So a lot of people are freaked out, right? They don't want to do that. You have this machine here. We're showing the cardiac science model, but look at it. It's a plastic box. Nobody knows what happens when you open that box. I'm military, so I like to call it an IED, right? An improvised explosive device. That's something that nobody wants to be around, right? Because you don't want to hurt somebody. There's no override. This machine is smarter than us. If you put it on somebody and you go to shock them, it's not going to allow you. And the one thing about the AED, I just saw this the other day. You'll see the date is September 21st of 2018. So in student athletes, there's an 89, I guess kids under 16, I should throw that in too. So when there's an AED within 1 to 3 minutes, it's an 89% chance that you're going to save that kid's life. So think about what's 89%, and we'll just say 7,000, right? Because that's how many kids die each year. Now, they're not all student athletes, but you think about it, it's like 5,000 or 6,000 lives that could be possibly saved. 89%. So let's go into hands-only CPR. This is the new kid on the block as of 2008. Most of you probably already know this. I know a lot of the schools are teaching it, but the studies have shown that it's just as good as performing mouth to mouth. There's enough oxygen in the human body to circulate for about an average of 10 minutes. And actually the compressions alone have an inhale effect on the lungs. We'll keep moving here. So, now it's a easy, and this is for everybody, not just school, but it's basically call, push, restart. That's the new CPR. If somebody goes down, you call 911, start pushing, and then as soon as the AED gets there, you put it on right away. So this is a fact sheet, and again, I could get you this information if your school is not participating in teaching the kids hands only. And then the slide on the right, it's basically the training kit that's provided by the American Heart Association, and it's got a a disc that comes with it that basically hand walks the kids through everything. It comes with 10 mannequins, and it's an excellent program. So as I told you, when I was standing in the emergency room with my daughter, a lot of things were going through my mind. And I made a deal with God that if my daughter pulled through, that I would do everything in my power to pay it forward. And I always tell everybody, when they shocked my daughter back to life, they shocked me back to life, because this gives me a purpose. And it's like, I always tell people, it's like selling water in the desert. Once you open people's eyes to this problem and how underserved this problem is, it's easy. I don't really have to do anything. But we started our mission. And the biggest thing I found out about was most people don't know CPR. So one night, on July 19th, 2016, it was about 10 o'clock at night. I just figured, well, let me do this. I'm going to go online and I'm going to look up all my school board members. And I wrote them this email, and they all responded. And in May of 2017, I had several meetings, but my daughter and I went and presented before the Brevard County School Board. And they voted, and then November 1st of 2018, it was adopted as a policy for our community. It's one of the best days of our lives around here. So then I started looking at the state, right? At the state of Florida. One of the school board members came to me and said, you should head this up, because there's several states in the United States where it's mandatory that no kid can graduate high school without CPR training, a 1-hour class. And I forgot to say that about Brevard County, a 1-hour class. They're not getting certified. They're just learning how to save a life. You can use algebra, you can use physics, you can use that to get into Harvard or Yale. But if your mother goes down, or your child one day in the future goes down, and you save their life, there's nothing better than that in my eyes. So my daughter, myself, and the school board member here, we started pushing for state legislation. Lexi got up and spoke in front of student governments. We went on Fox News here, and we did a lot of things to generate support. We went in front of the state Senate, and we gave a briefing, and we talked about CPR and why it's so important. And then in March 11th, 2018, Governor Rick Scott signed a bill, 7055 and SB4, and adopted it into the state of Florida, where, beginning in grade 6 and every 2 years thereafter, children will be taught a 1-hour CPR course. Then I just want to read this real quick. So around when all this was going on, there was a doctor down in South Florida by the name of Ted Brady. And he sent me this email. And I'll read it to you, but he lost his daughter at school. And he says, as you know, my daughter did not survive. She was healthy, a soon-to-be teenager who played sports her whole life. And, she went down at school and she died. And this is what kills me. Had someone at her school used an AED before the paramedics arrived, probably 8 to 12 minutes, then she would have survived. And I believe that this should be a national campaign. And that sort of stoked my interest. So cardiac emergency response plan. This is something that I want you all to pay close attention to as well. What is it? It's basically a written plan for how to act when there's cardiac arrest in your school. When a child goes down, what do you do? Typically, in the military, we call it the fog of war, right? People start running around like crazy. They don't know what to do. They hope the school nurse or the athletic trainer is around, because it's mass chaos typically. And the reason we need a cardiac response plan is we need this says it beautifully, a carefully orchestrated process where everybody has a job, everybody has a task, and we know what to do, so our kid can be one of those 89% that survived instead of dying. So I did a briefing here in our county here. I didn't want to put all the information on where, but look at this. Look at what those tabs say: emergency procedures, fires, explosions. This is the things that they prepare for. These are the things that they have a checklist for. What about the #1 killer on our campus, right? We already established that. How about this? And this is actually a good thing because it shows us that the drills work. There's been no deaths in a school fire in the last 50 years in the United States. A year or so ago, there was a kid that committed suicide. I believe it was in Colorado by setting himself on fire, but it wasn't a school fire per se. And here in Florida, there's a new policy that the schools will do 10 fire drills a year and then 10 school shooting type scenarios a year. So 20 drills, nothing that I know of, and maybe you all know something different, but I've looked at it, covering the #1 assassin on our school grounds. And here we go, the #1 killer of athletes, the #1 cause of death on our school campus. We'll go to the next. So what is a cardiac emergency response plan, and what do you do to implement one? So this sort of goes into steps. This will be available in my slides. And also I have a slide at the end that's got some resources for you to go through, to help you later on. But basically it's planning. You want to set up a team. A lot of times that involves bringing in the local fire department and the experts. You want to write it out. It needs to be written. You need to have an AED. You need to have it where it's accessed. People can get to it. I had a basketball coach who stood up very angry at one of the last briefings I did. He runs practice at 7 a.m. in the morning. Guess where the AED is? It's locked up in the athletic director's office. What good is that going to do when your kid goes down? Then you want to conduct drills, which we'll go into. And then you want to share your plan with the community, right? You want to get community support. So here in the medical field, I work in a VA hospital now, but in big medical facilities, we do something called mock code blues, and they're just practice runs. The clipboard police that we all know and love, they come around and they stand over your shoulder and they make sure you're doing everything right. And we hate them, but they have their purpose and they keep us sharp. And that's what we need in all of our schools. We need to be running through scenarios. Even us in the medical field, we're scared to death when it goes down. And this is what we signed up to do, and we do on a daily, on a routine basis. Imagine some poor school nurse or a trainer or a gym teacher. It's scary. And the only way to get better at stuff is practicing. So this is the American Heart Association chain of survival, and it sort of takes you through the steps. The big thing really is recognizing sudden cardiac arrest. If you got a kid that goes down all of a sudden, he's gasping, he's gurgling, agonal breathing, and he's doing seizure activity, and you know that this kid has no history of seizures, then you need to think sudden cardiac arrest. I get notifications all the time of these different cases where kids die, and almost 9 out of 10 of them show seizure activity. Again, early 911, CPR, get to AED, and then wait for help to get there. I came up with this when I was doing my initiative. It's called the TEACH, Chain of Survival. And again, it goes along with that last slide. The T is you want to touch them. Are they responsive? Are they breathing? No, you have an emergency. You call 911. The A should trigger get the AED, put it on right away. Compressions, they should be started immediately. And then the H is obviously wait for help and wait for, the ambulance to get there. So, looking at it, there's only a handful of states that have AED laws, right? So take a look at that, see if your state is on there. So here's the list, right? This is the list of all the states that have something on the book for AEDs. It comes up to about 17 out of 50. And a lot of the ones that you show on here, they have to raise their own money. Oregon, Alabama, Rhode Island, Texas, and North Dakota, the state buys the AEDs and helps them implement the cardiac emergency response plan. this to me is hard and disgusting. It really, really is something that makes me crazy, and that's why I need your help. So the next here, I met with a local congressman here, Congressman Posey, and he represents our district. And I wanted to get involved at the national level, so he got me set up with a representative who's got a bill in the works to try to make it mandatory for, getting AEDs into schools and running cardiac emergency response plan. This here is from the Surgeon General. It's just sort of a letter of support that he sent me. One of my patients knows him and told him about what we're doing. This right here is an amazing story. This is Dr. Wynn. He's one of my good Air Force buddies. Well, that little girl with the red hat right there is my Lexi. He delivered my Lexi. His smiling face, that smile you see, is the only time I've ever seen Locke is with that smile. Well, about 2 years before Lexi's episode, Dr. Wynn, at 45 years old, was playing basketball, and he went down, and he went into sudden cardiac arrest. And lucky for him, his brother was there, who was a doctor. And then the guy that ran the gym happened to come in 10 minutes early and was unable to lock his office to get the AED, and they were able to shock him back to life. That's him on the left, obviously. And then when Lexi got her defibrillator pacemaker put in, him and his wife came to see us. Sudden cardiac arrest has stricken my family before. About 2 months before Lexi's episode, my brother's wife died suddenly at 50 years old. Again, when it first happened in my brain, I thought, oh, well, she died of cardiac arrest, meaning she died of like a heart attack or a brain aneurysm. Well, I got the death certificate. It was sudden cardiac arrest. The young man on the bottom is my cousin's son. He died at age 26 in his sleep. And I feel horrified to know, I mean, he smoked weed, he used some drugs, but everybody sort of thought in their brain, oh, he died of a drug overdose in his sleep. And soon after this happened to Lexi, I talked with his mom, and Michael had marijuana in his system, but nothing else. And he had narrow coronary arteries, and he died in his sleep at 26. This slide here is, again, something that we're involved with. This is a group that we work with called Who We Play For. And they're a group that goes around to all the local high schools and some of your smaller colleges. And we do EKG screenings on athletes before they take the field. As I talked about earlier, the #1 killer of our kids is sports. And, at school is sports. And this group we work with, their process, the studies show that up to 90% of kids can be found with, abnormal heart rhythms and deadly heart conditions. And my daughter Lexi actually screened one of her best friends, Santana, who's on the right, and she has a deadly form of something called long QT syndrome. She was a competitive soccer player. She never had one problem in her life. And right now, she's not able to play sports. And they're trying to figure out if there's a heart surgery that they can do. But more than likely, at some point, she would have died with exertion. And then most recently, a few months ago, Lexi did a screening at one of the other local high schools. And she found 2 kids with definite deadly heart conditions, cardiomyopathy, which is the #1 killer. And that led to one of their brothers being screened. So that was 3 kids that came out of one screening. This is Lexi today. She graduated high school in May. She's going to nursing school over in Orlando. She wants to be a pediatric nurse, and she's living a great life. She's gone through a lot of mental stuff, as you can imagine, from being dead at 16 and being saved. She doesn't remember much about it, but her heart is all in it, and she's doing everything she can to give back. This is the last slide here. This picture is near and dear to me. This is a picture of Jesus. This is from, and I know I'm not supposed to get religious on you, but this is Jesus in Mark 5. There was a gentleman by the name of Jairus, whose 12-year-old daughter had recently been ill and had died. And this guy ran and found Jesus and begged him to come to his house and bring her back to life. And he did. He came in and basically he said, this little girl is not sleeping. Is not dead. She's only sleeping. And he grabbed her hand and she got up and started walking around. And when Lexi was going through a lot of her initial workup, I was a mess. You know, sometimes knowing medicine too much is a curse, and I did. And a friend of mine from the Philippines, I was stationed in the southern Philippines during a deployment when we were, over there for some terrorist stuff, I guess. But long story short, he sent me this. There was one day I was laying on the floor of the hospital, a mess, and he sent me this in this verse, and it completely changed my life and my outlook. If I could get a tattoo of this, I would. Here's some resources for the cardiac emergency response plans. And, we'll take questions. This is my information. My email is Shawn, SHAWN, last name SIMA @AOL.com. What I really want from everybody is that you will take this information and you will go attack your principals, that you'll attack your athletic directors, that you'll attack your school boards and your state legislatures. We spend billions. Our governor wrote a check for $400 million in a span of 17 days after Parkland. And when I went around and I met with different legislatures on my quest at the state of Florida, I heard poor mouth, this, we don't have the money, where are we going to get the money? And it's minimal, it's pennies. The problem is we don't have the voice, and that's where we need you. Our folks don't go marching on Washington, and we don't get on the news. Our kids, unfortunately, are put in body bags, and they're taken away to the morgue, and then you have the funeral, and you have a little blurb in the newspaper, and you don't hear anything else about it. But we have 7,000 kids every single year. 223 kids from school shootings. That comes out to 12 over a 19-year period. You think about 7,000 times 19, and why aren't we doing something about it? And this is where I need you on my team. Thank you so much. I hope I didn't go over too long. I'm going to go ahead and turn it over for questions.
Thanks, Shawn. Thanks for that great information. I do have some questions that are coming in here, so I'm going to start fielding these over to you. Had a couple of questions about getting the recorded session and the slides. We will make sure to communicate with that with everyone via email afterwards. We will send a link with the recorded email or the recorded webinar out to everyone. I've got a question here from Cara. She says, my school district is resistant to implement an AED program because they fear liability issues. What response do you have for these school officials?
There is absolutely no liability as long as where it gets a little cloudy. And like I said earlier, there's been no lawsuit that's been settled because of the Good Samaritan law. But the big thing is making sure the battery works and that the machine works. That's the only time I've ever heard that it ever came into question, and they still did not win. You got to do the battery checks, and you got to make sure the pads are good. A lot of people think the AED, you get it, and it's good forever. You've got to make sure you're checking it. And if she wants to email me, I can get her put in touch with a lawyer out of the state of New York who's sort of the foremost expert on tort law and all that stuff, that can give her factual information and talk to those folks that are giving her the resistance. You think about the cost of what it costs for somebody to die at school. Like I've looked at my daughter. There's no money. There's no money put on it. It's a no-brainer. And again, long answer to a short question. I can help that person, but there's no lawsuit that's ever been settled. That would be a a devastating game changer for people willing to help.
Well, and it's also important to remember that these AEDs, as you mentioned, Shawn, they're really smarter than we are. You put the pads of an AED on a victim, and the first thing that AED is going to do is analyze the victim and see what's going on. It's not going to deliver a shock if a shock is not warranted. So
Right.
there's not really any danger of putting an AED on somebody if you don't know what's going on. It's not going to cause harm.
And that cardiac science model one that I showed in there, that thing, as far as the checking it, that particular model does self checks every day. Some of them do them once a month. That cardiac science model will do self checks every day to keep it rescue ready.
Yep, it's going to check every day and alert you if there are any problems with the pads or the batteries.
Exactly.
I've got a question here on the heart screenings that you had talked about that Lexi had done. How did you organize this kind of event?
So we got on with this nonprofit, the Who We Play For, and actually my wife has taken over actually scheduling and reaching out to all the different athletic directors and school principals and bringing them, the information. And then typically, we have it down to a science here, where once they say, okay, we're going to go ahead and do it, it's usually through donations. So the local hospitals here, a lot of them donate money to the nonprofit. And we usually come in with 5 or 6 EKG machines. Now, they're not the EKG machine that you have at Dr. Jones' office. These are little Bluetooth models with 12 cords on it that we attach. And then what we do is once we do the school, we go ahead and bundle those up, and then we send them to there's 3 cardiologists throughout the United States that are sort of experts, if you will, in sudden cardiac arrest. And then they go ahead and overread those EKGs and then look for the subtle changes. There's several programs throughout the country. In Florida, we have Who We Play For, but California, Texas, the Northeast, Washington, they're all over the country, these heart screening programs. So if you would like to set it up for your school, again, if you want to reach out and contact me, I'll find out what's the closest one in your area. It's something that, again, if knowing what I know now, and here's the other thing, I'm a PA. I can't tell you the number of school physicals that I did in my life. So I know I almost want to say, a lot of times we do these school physicals, we listen to their heart and lungs, we check them for a hernia, pat them on the back, and they're good to go. But if your doctor is not having these kids bear down, squat, clench their fists, and really do some things to bring about a heart murmur, sometimes I just feel like the school physical is not enough. I'm going to go ahead and say it and probably start a riot, but it's just not enough. And this program that we do, and a lot of places do, will find a lot of your heart abnormalities that are silent.
Okay. I know that we're at time right now. Shawn, are you okay on time to take some more questions?
No, please. I apologize, but yes, I'm willing to stay as long as.
Great. So I've got a question here from Katie also on the screenings. And I heard you mention that there were donations that were involved from some people, but how much does it cost to go through a screening like this? And are you providing a questionnaire for
Yes.
people?
Yes, there's a 14-point questionnaire. It goes on the Sanford criteria. And so we do the questionnaire first, and it's questions like chest pain, the nearly passing out, family history, have they been ever told they couldn't do sports before because of a heart ailment? Anyone die before the age of 50 suddenly? And there's, like I said, 14 point, they'll ask medication. And then we do the EKG. And for your information here, if it's not sponsored, it's $20 a kid. So it takes 5 minutes, $20, and you get, an expert reading, and it gives some peace of mind. If you go, a lot of people will go because they know I'm crazy. They'll go to their pediatrician, they'll ask them. Well, the American Academy of Pediatrics will say, well, that's not warranted. They're not having any symptoms. And in my opinion, they're wrong. It comes down to money, right? Because if you get it at your doctor's office, it might be $150, where we provide it for $20. So, a lot of the pediatricians and that don't do it. But the studies show anywhere from 67 to 90% of silent but deadly heart conditions can be caught. Unfortunately for us, we still don't know what caused Lexi. She went through a full workup and we don't know. And that's why the AED program is so important. Your primary offense is screening. Your primary defense is have an AED and somebody that knows CPR within 1 to 3 minutes of wherever you're at.
Okay, thank you, Shawn. Talking about hands-only CPR, Sarah asks, what is the youngest grade level you would recommend hands-only CPR and AED use be taught in schools?
Right now, it looks like the typical time frame is 6th grade. I think that's who the American Heart Association goes off of. But honestly, if you've used an AED, I mean, you could teach some 3rd and 4th graders to do it. But I think the recommendation, just because some kids are more advanced than others, is 6th grade.
And that's the information we have as well from the American Heart Association. We do have the CPR in Schools kit that you mentioned earlier in your presentation. In fact, School Health is the exclusive distributor of that kit for schools. And 6th grade is the recommendation for that CPR in Schools kit.
Yeah.
On the drills, how often would you recommend drills? We were talking about, fire drills or active shooter drills. How often would you recommend drills for sudden cardiac arrest?
I honestly would recommend it, especially for, folks that haven't, that don't do it as much as we do in a hospital, probably once every 3 months, once a quarter. And it doesn't have to be the whole school, but, you want the folks that are going to be a part of the drill, typically your team, you want them to be ready. You want them to know that, okay, we have a code blue. I need to go run to wherever that AED is and bring it. The other thing, which I thought about this a while ago, was once we get the hands-only CPR component in the schools, you're going to have, 30 kids in the class that hopefully know CPR and that could pitch in and help. I know I've talked with several school nurses in Florida that they're it. So if Miss Jones goes with her family to the Keys for the week, then hopefully somebody else is there and ready to pitch in. For Lexi, thank God the girl that wasn't pictured in that one photo, the other guys were doing CPR, but nobody thought to go get the AED, and she did. So sometimes when you're freaked out and the crap is hitting the fan, you need a bunch of minds working together. And I think at least once every 3 months, that team should run through a scenario and be ready.
Okay, great. Thank you. For writing up the cardiac drills, any comment on who would be responsible for that? Is it the school administrator, school nurse?
Yeah, I definitely feel like the school nurse should probably be the head of it. And then you want the administrator, the principal, probably the dean. And, I would want the gym teachers, maybe the athletic director or gym teachers. I would want them as part of the, the team that, gets everything ready. And then also I would say a local, fire department, fire chief or something like that. So, they could sort of look at things from their perspective and help to get everybody dialed in. But we know that chances are that if a kid goes down, it's likely going to be in gym class or somewhere where kids are being active. So I think that's why it's so important to have especially your athletic directors, your coaches. Nobody should be practicing on a field without an AED out there on a golf cart or something. You want that AED on the person in 3 minutes.
And an important thing to remember with that is the 3 minutes includes the travel time that it takes to go get the AED. So that's a 3-minute round trip.
Exactly.
Important things to remember are, are there stairs that you have to go up and down? Is there a door that may be locked? All of those are important things to keep in mind when you're thinking about where your AEDs are positioned throughout the school.
Exactly.
From Jamie, a comment that says, our school had a comprehensive SCA emergency response plan, but felt it was too complicated. Around 40% of their staff is CPR trained to respond in an emergency. Do you have suggestions for this situation?
They felt it was too comprehensive.
Too complicated, she says.
Too complicated. Yeah, I don't know, sort of like that handout I posted. There needs to be, a plan. It doesn't have to be complicated. It's, make sure that the AED is available, make sure that people know to get it, make sure that, people respond. To me, I don't know why they felt it was too complicated. I think if you just stick to the basics, if 40% of their staff knows CPR, that's great. But I'll tell you, for me, I'm a medical provider. And when I used to take CPR, especially old CPR, I would think in my brain, boy, I hope if someone's going down, they're going down in the next 30 days. Because I used to try to remember, all right, this one gets 15 compressions, this one gets 30 compressions. I'm supposed to push 1.5 inches deep on it. It was so confusing. So if something happens, you don't want to have to do too much thinking. It should be a practice dance. And I don't know how it could be complicated if everyone just has, their position, who gets the AED, and, practice a plan. I don't know why it's so complicated, honestly.
Okay, thank you. Question from Lorene asking, should the school nurse train all of the staff members, or would it be advisable to have a specialist come in and train the staff members on the use of an AED?
In my personal opinion, the AED is so easy to use that I believe that the school nurse, if she's comfortable with it, I believe the school nurse could do it. I don't, and would be the other thing. If that nurse is not comfortable, a simple phone call to one of the local fire departments, and they'll come in and they'll show you and run through it for you. But I would think as uncomplicated as those AEDs are, that the nurse could do it if he or she is comfortable. And definitely people need to know what that AED is about. I did probably 100 people here in my county, a lot of coaches and administrators, athletic directors, and I pulled out our AED that was in the school, and none of them knew what to do with it. And it's always, and you might have had this in your experience, people are like, that's it? That's all it is? It does everything. I mean, the AED basically talks you through everything and tells you how to do everything. So that school nurse, he or she may just say, yeah, well, let's open it up and see what it tells us to do, if you don't like talking in front of people. But no doubt everybody if your school has an AED, then every person working in that school should know how to use it. Okay. Sorry for the pop-ups, of course.
No problem. Let me see what we've got here. Question from Erica. Do you have to have special permission forms from parents in order to perform the 12-lead ECG in schools?
Yes. Yes. There's a permission slip that goes home. We usually coordinate that with the athletic director, and they send those home, and then the parents will sign it. We do get kids, like all kids, that, they're supposed to bring it home, or the parents don't give it to them, or they get it and they lose it. Whereas the kid shows up, we'll get on the phone and we can do verbal consent as well from the parent. But yes, they do have to have, consent.
Okay. All right, we're quite a bit over time. I'm going to go ahead and stop us here. Shawn, would you give your email address one more time? I've got a few questions that are coming in that I think people can reach out to you directly for.
Yes, it's Shawn, SHAWN, Sima, SIMA, at AOL.com. I'm old school.
Okay. And just looking through the questions here still unanswered, I want to remind everybody that we will have the PowerPoint presentation available for you. We will have the recorded presentation available for you. I see that there are some comments here that people wanted to review some slides or some information. Questions on the American Heart Association hands-on CPR information. Remember that we do have the AHA's CPR and school kits available on our website, schoolhealth.com. We are the exclusive distributor of that kit. So the schoolhealth.com website is a resource for you there. Thank you, Shawn, for sharing your wealth of knowledge for us today. It's been a great presentation. I'd like to ask everybody who's remaining here to participate in a short survey as soon as we close the GoToWebinar interface. It's just a few questions long, but it lets us know, what worked for you and what you might like to see differently next time. And as I mentioned, we'll be sending the recorded presentation out. I would expect that in the next 5 to 7 business days. Thank you, everyone, for joining us, and this will conclude our presentation today.
Thank you, everybody.